Microalbuminuria refers to persistent protein loss that's too small to be detected by a standard dipstick, but higher than normal, typically between 30 to 300 milligrams per day. It is used as an early warning sign of glomerular injury, especially in diabetics and in high blood pressure. Detecting microalbuminuria allows for early intervention before overt proteinuria or irreversible kidney damage develops. For diabetic patients, annual screening is recommended starting 5 years after diagnosis of type 1 diabetes and at diagnosis for type 2 diabetes. We can also look at urine albumin to creatinine ratio, and this is the preferred method for detecting and monitoring microalbuminuria. Unlike a 24-hour collection, which again, not so fun, this test uses a single voided sample, typically first morning urine, which minimizes any variability. The ratio reflects both kidney damage and the effectiveness of treatment, and any changes can show improvement or worsening disease. It's especially useful for diabetic and hypertensive patients, like I said before, where early detection can alter the course of nephropathy. Albumin excretion of 30 to 300 milligrams per day suggests early reversible kidney involvement. And this is looking at kind of a whole process. Whoops, before I get to kidney stones, whole process of albumin and protein testing. So when we look at kind of our urine dipstick, we can see positive versus negative, and we can kind of go down this track to evaluate and work up what we might be looking for next. But to summarize kind of what we've been discussing so far, evaluating protein and albumin excretion gives us critical information about glomerular integrity and tubular reabsorption. Persistent proteinuria or albuminuria is a hallmark of chronic kidney disease and correlates with cardiovascular risks as well. These tests, whether 24-hour protein to creatinine ratio, or albumin to creatinine ratio, each have their place depending on the clinical setting. Always, of course, correlate the lab results with patient symptoms, blood pressure, and other indicators like estimated GFR for a complete renal picture.